Fertile Minds is a podcast brought to you by Virtus Health, who have more than 40 fertility clinics globally and in Australia, including Melbourne IVF, IVF Australia, Queensland Fertility Group, and TAS IVF. Our goal is to demystify fertility and assist you in getting pregnant faster. Over the coming episodes, we'll be sharing helpful tips and evidence-based advice around key fertility topics, so be sure to browse our episodes and subscribe so you don't miss a thing. You can also watch videos of these recordings on our Fertile Minds YouTube channel. Let's dive into today's episode. Welcome to Fertile Minds. I'm Dr. Kokum Jayasinghe, a fertility specialist at Melbourne IVF. Today, I'm delighted to be joined by my colleague, Dr. Yousif Alyousif.
Hi, I'm Dr. Yousif Alyousif, also another fertility specialist at Melbourne IVF.
Today, we are exploring unexplained infertility and reflecting on the inspiring journey of Christie and Perry from season 2 and 3 of Big Miracles on Channel 9. Big Miracles follows the remarkable journeys of individuals trying to conceive, filmed in Virtus Health clinics, including our very own East Melbourne fertility clinic at Melbourne IVF. It's a story of hope, heartache, and triumph.
That's right. I understand you feature on the program, Kokum, with one of your couples, Christie and Perry. Can you tell us a little bit more about Big Miracles and how patients get selected?
For sure, Yousif. All of our patients were informed about the opportunity, and patients volunteered to share their stories through recruitment process. Many patients were filmed, and this took months, and only selected few were chosen to appear on air. This selection was made by Channel 9, not by the patients, doctors, or the clinic. Their goal was to represent a diverse range of fertility experience, different cases, emotional journeys, successes, challenges, and of course the personalities to reflect the complexity as well as the humanity of these issues, and of course to keep it more interesting for the viewers and the audience.
As you know, Kokum, infertility is such a personal journey, and some couple might not even share it with their closest friends or their family. And when you're filming such stories, you're broadcasting this to the world. So how do you maintain confidentiality, the ethics behind it, and the boundaries?
Very good question, Yousif. I think we all owe a huge thanks to all of these patients who featured in Big Miracles. So it came from their hearts to raise awareness. Yes, infertility is such a private and a personal area, and there is sometimes a stigma associated and attached to that, and that's what they want to break, the stigma and the taboo behind the whole topic. So these people are letting the viewers into their private lives and to have a glimpse of what exactly going through in their lives when they are facing and going through treatment. So we are really thankful for letting us watch these things and raise awareness and break the taboo. So we are trying to encourage these conversations and make it another medical condition. So people who are suffering in silence are actually encouraged to talk about these things and to be able to get help sooner. The film crew and the production team did a remarkable job keeping the ethics and keeping the boundaries, as well as bringing these stories authentically to life. So I have to say, I heard from one of the production producers that they go to the patients' houses and wait around for could be hours until that original phone call comes, because they were telling me these are very emotional moments, the yes or no or the positive or negative answer they get on the day after a pregnancy test. And not even Brad Pitt or Nicole Kidman would be able to do these things acting. So it is just they want to catch that real moment to share the experience. And when we were filming, we were aware of the sensitive nature of some of the information we have to give to the patient. So again, the crew handled these situations in such a way that we could maintain those elements and still give them the tender loving care, the time they need, and maintain the sensitivity of the topics.
Absolutely. That is very generous of those couple who volunteer and choose to share their stories with the world. And I'm sure that will break a lot of the stigma associated with infertility. And I can imagine for you, this is different to your day-to-day practice and what you do with consults. Did you feel like a movie star? Can you give us a bit of a glimpse into the background of what happens behind the scenes?
Funny you ask, Yousif. In fact, it's totally the opposite. So I'm the humble doctor, and the true hero is the patient who's actually volunteering to share her stories and raise awareness. And my patient, which I had the privilege of looking after for quite some time, Christie and Perry, they have been through a lot. They faced many challenges, and still they shared their experience on air. And of course, when they started filming, they didn't know the outcome and what it is going to be. So I certainly have very much appreciation for these heroes. So compared to a day-to-day consult, one of the main differences were we had to allocate a reasonable large amount of time because certain things the production team would ask you to go through again and again. So that is making sure not only your patients understand, but the audience understand the language we use, the information we are giving, and the possible outcomes. So that was definitely one thing. Another thing was trying to organize the filming without interfering the other patients in the clinic. So maintaining their privacy and also some of the time critical nature of the procedures we do. Like egg collections. So if the filming is running late, we want to make sure these cases, these patients are not getting affected by those. So there's a lot of planning behind these things.
That sounds like a very delicate job and a lot of time commitment and effort from you, from the patients and the crew as well from Channel 9. So well done to you all, and we're looking forward to watching the next episode. Let's dive into our main topic today. Can you tell us what is unexplained infertility?
I think use of unexplained infertility is the most frustrating diagnosis for the patient or the couple as well as to the doctor. And just imagine after going through many tests, you turning around and saying, there's nothing wrong. You can just imagine the look on the patient's face, the perplexity as well as the surprise to say, what do you mean? Why am I not falling pregnant then? So after a certain test and investigations, if we cannot find anything wrong, what I mean by test is we confirm there's no issues with ovulation, and we look at the semen analysis to make sure there's enough sperm and they are moving fine and there's no male factor associated. And we check the patient's tubes to make sure the tubes are open and there's no tubal factor, as well as the uterine structure. There's no structural abnormality in the uterus. So once all of these factors are ruled out, if the patient is under 40 years old and they have been regularly having unprotected intercourse and trying for pregnancy about 12 months, they come under the category of unknown factor. And unfortunately, this is not that uncommon, and it is a common diagnosis among couples that we see. Up to 10 to 30% of couples could come under this category. And from the doctor's point of view, just imagine you humbly looking at them and saying, I just don't know why you're not falling pregnant. So I don't think there's anything to be ashamed of that. It is just you being very honest and clear with them. We have done the basic test and nothing is showing up as abnormal.
Absolutely. And that is also supported by evidence and a lot of the international and also our own Australian guidelines. I mean, as you know, I always say I'm a very simple-minded person. When it comes to fertility, I say we need three things. We need an egg, we need a sperm, and we need a place for them to meet, right? So, and that's where we focus our investigations. We do a lot of investigation to check, one, do we have an ovary? Does the ovary has eggs? Can we release those eggs? And then we look at the sperm, we look at the quantity, and we look at the quality when it comes to movement, for example, and the shape of the sperm. And then we do an ultrasound scan to see, is there any blockage along the way? Do we actually have a uterus? Because there are some women who are born without a uterus, for example. And then we need to make sure the tubes are not blocked, because you could have tubes, as you said, but they could be blocked. They could be open, but maybe they're not functioning. And that's the catch with the tubal flush test. The tube is more delicate than just a pipe, or just a tube. So the dye might pass through it, and we say the tube is not blocked, but doesn't necessarily mean it's functioning 100%. Because if we follow the journey of the egg and the sperm has to swim all the way through the cervix. get through that cervical mucus, and sometimes there's an issue there. There's no easy test for that. And the sperm might make it to the tube. And inside the tube, there are very specialized cells. And on top of the cells, you have this delicate hair or cilia. And there is no test for that again. It can show up on ultrasound scan. It can show up on a tubal flush test. So even if that test tells us the tube is functioning, it doesn't necessarily mean there's no tubal factor. So when we say unexplained infertility, we're only saying we tested the main building blocks that we need for fertility, and those tests have come back as normal. So they might be an explanation, but we just don't have a test for it yet. Or there is very specialized group of patients where we might do X-ray test. For example, you have a patient who comes in and they have issues with painful periods. They have pain at other time of the month, for example. And then we might go down the path of testing for endometriosis. And we're lucky these days where ultrasound has become so advanced, we might be able to pick up endometriosis on ultrasound scans, while others might need a diagnostic laparoscopy or a keyhole surgery, for example. Not everyone needs that. And that's where we, as fertility specialists, we discuss all these pros and cons of each step after we do our initial testing for the egg and the sperm and the anatomy. And then we individualize our treatment or our X-ray test to the couple in front of us.
Absolutely, Yousif. Couldn't agree more. So I think when we say unknown factor, the causes could be too little or too subtle. So we need to definitely individualize the treatment. Not everyone needs a laparoscopy. Some may benefit from a laparoscopy. Some may need that down the track if treatment is not working. So I think the way of treatment is individualizing care. And key points that would come into focus or consideration when we are working out what is the best treatment for the patient is how old is the female. And that's one of the key factors. We could not stress enough the point that fertility treatment, even IVF, depends on the age of the female and how long they have been trying. So to come to the diagnosis, we say under 40-year-old trying for 12 months. But sometimes when these patients present, they could be trying for 4 or 5 years. And it's in fact, that's one of the things our hero patients trying to do in Big Miracles, raising awareness and trying to break down that stigma so patients talk about this freely with their friends, colleagues, and then say, hey, something not quite right here. It is okay to go get help. So the other main factor is their overall family goals. How many kids would they like to have? So if they are just after one, yes, they can afford to try a bit longer, but do they want a larger family? And in that sense, certainly it's a good idea to seek help early. So all these factors come into play when we advise them on treatment. So tell us, Yousif, what treatment options are available for unknown factor?
As you correctly said, we have to individualize the treatment to the couple in front of us, their family goals, and what we've learned from doing all the basic investigations or extra investigation that they might have required. We know one of the most powerful fertility treatments that we have is IVF. And we know that has the highest success rate. When it comes to unexplained infertility, what do you normally say to your patients about their chance of success when it comes to IVF? Do they have a lower chance of success because we don't have an explanation?
I think you are absolutely correct. The IVF would give us the highest chance of pregnancy rates. It's mainly because a lot of those factors you mentioned, the functional tests that we do not have available currently, are going to be bypassed by IVF. So when we check a sperm sample, we say the concentration is normal, they look good and they move fine, but do they actually reach that egg and fertilize it and develop into an embryo is not something we can test inside the body. So sperm function we can't test. As you highlighted, the tube function we can't test, and the interaction of the egg and sperm we can't test inside the body. So all of these factors can be bypassed, and we get a unique opportunity to observe the behavior of the eggs and sperm and their development in IVF when we take the eggs and sperm to the lab. So in fact, my experience and the literature would say in young patients, with unexplained infertility, they have the highest pregnancy rates, and vast majority would be pregnant straight away. I want to mention one point there with big miracles. Sometimes we get the feeling it's a drama. There's a lot going on with these patients, which I truly understand, and that's what we see day to day. And we want to get the viewers the understanding of how it can be. At the same time, not every patient's journey can be that dramatic or long. Some patients get pregnant straight away, especially the young ones with unexplained infertility, because a lot of these factors we cannot test inside the body is overridden, and we jump the queue, we bypass them, and egg and sperm get fertilized. We have a beautiful embryo, we transfer it, and she gets pregnant.
As you know, unexplained means you have the building blocks that we need. And by doing IVF, we are bypassing a lot of these potential issues that are hard to test for, and maybe there is no specific treatment for either. And when we put the egg and the sperm together in the lab, you bypass the issue potentially with the cervix, with cervical mucus, with potentially with the tubal problems, and sometimes even more rarer, potentially rarer problems like sperm that might not bind with the egg, for example, which you can't test for that in the body. And it's not until you look under the microscope when we put the egg and the sperm together, and then we realize that the sperm can't bind to the egg, for example, which is uncommon. But if we notice it in the lab, and that's the other great thing, IVF has advanced so much recently, and we have these tools that we can use in the lab to overcome some of these problems. For example, if the sperm can't bind to the egg, we can bypass that. We can inject it directly inside the egg, which some might be familiar with the term ICSI, or intracytoplasmic sperm injection, which not everyone needs. Sometimes just with simple IVF, we can overcome many of the problems that could contribute to unexplained infertility.
Absolutely, totally agree. So the patients who want to go to where the highest chance of pregnancy, and also the couples who want to keep their family goal of having a larger family, may decide to move on with IVF sooner than later. Not all our patients are in the same category, Yousif. So I think when it comes to unexplained infertility, a very good way to start is trying to optimize their health, going back to the basics and asking, are you in the best health you possibly could be? Going back to the basics, the diet, lifestyle, environmental toxins, and endocrine disrupting factors, all these things to get out of our equation and make sure that we are giving them the best possible pregnancy chances naturally or even with IVF. So tell us, is there any other treatment options, and what are their success rates like?
Absolutely. So I agree with you first. In anyone who's planning pregnancy, whether you have fertility problems or not, aim to be the healthiest version of yourself you can be. Whether that's removing toxins, like you said, like smoking, excessive alcohol, drugs, other chemicals in your environment that can have a negative effect, and optimize your health, optimize your weight, optimize your BMI, optimize your diet. But when it comes to other extra fertility treatment, yes, IVF has the highest success rate, but some couples don't want to go towards IVF because maybe they're young, they have a bit more time, they're aiming for one child, and they don't like the idea of going through a full IVF cycle. Sometimes finances might be an issue. So there are other more simple treatment options. And one of the common ones is called intrauterine insemination, or IUI. And usually, if we're doing this treatment for unexplained infertility, we combine it with ovulation induction, sometimes called OI, or ovulation induction. Can be done with a tablet, or can be done with some injections, like a mini IVF type cycle. And the way I try and explain this to some of my patients is you're giving the sperm a head start by doing IUI or insemination, but also more than one target to aim for. If we can get the female partner to grow more than one follicle, for example. And that's also, again, supported by evidence. That's been shown specifically in the group of unexplained infertility. It does improve your chances of success. Maybe because we are overcoming some of the minor issues, like maybe the cervical mucus problem, because you're placing the sperm above the cervix inside the uterus. Maybe there's minor sperm problem, like sperm movement problem. And again, we give them a head start. And also similar to trying 2 months in 1 month if we have two eggs. And that has a good success rate. And the success rate does depend on the age of the female partner to a large extent, somewhere between the 10 to 20%, depending on the age. If you are above 40, maybe the chance a little bit less. And in that specific group, we'll probably push more towards IVF as a treatment option that will have better success rate. But if the female partner is young, there's no reason why we can't try IUI if you want to avoid IVF. But it does come with slightly lower success rate compared to IVF.
Slightly lower success rates and probably a slightly higher risk of multiple pregnancy rates when we are trying to aim for more than one egg, which the patient should be fully aware of before.
And I think as fertility specialists, we moved from let's get people pregnant to let's get them to have a baby to now the aim is one healthy child at a time.
At a time, absolutely, yeah. Yousif, another thing I noticed with unexplained infertility is the emotional burden. From the diagnosis itself to going through the journey can be quite challenging. So, what do you have to share about the patient's emotional journey when they're diagnosed with unexplained infertility?
As you correctly said, Kokum, a diagnosis of unexplained infertility can be challenging, emotionally, mentally, and physically. And couples might experience self-blame, anxiety, or they feel a little bit lost. It's like, what's wrong with me? What do you normally say to that?
That's quite a challenging situation, Yousif. As we both agreed, it is one of the most frustrating diagnoses for the patient and the doctor when we say there is no clear explanation, yet the pregnancy is not happening. So I normally see quite a negative association of emotions with unexplained infertility and the patients questioning themselves, what is wrong with me? And they're commonly asking you, what am I doing wrong? And there's a lot of negative emotions associated. And I try to give it a positive spin to say, hey, unexplained doesn't mean anything bad. In fact, not having a bad diagnosis is a good thing, because sometimes the diagnosis we can give you, which the patient may feel in a way content that there is a reason why she's not falling pregnant, is quite a difficult one to overcome. So I rather have nothing wrong than having a bad diagnosis. So then it is actually much easier to help these couples and get them pregnant. So that is a key factor. And also trying to give them some confidence to say, you should be proud about all the factors you are doing well and all these good things, that your egg numbers are good, your ovaries are looking healthy, your tubes are open, the sperm is normal, the uterus is normal. These are good things. So we need to twist it in a positive way to say, these are good things, these you should take credit for it, and this is a positive situation that we can easily help you, and try and put that negative thoughts away. We need to understand these couples have a lot of emotional needs and have to work in a team, just giving them constant support and encouragement. And also the couple themselves need to help each other.
I couldn't agree more. There's all this external support that we can offer. We have our counselors through our clinic, for example, your fertility specialist, your fertility nurses are all there to support you. But the biggest support that you have, your rock, is really your partner. You're there for each other. Lean on each other when you need. You're there to support each other throughout this whole journey. And you are a source of strength for each other because you are sharing this journey as a couple. And even though the journey can be tough, can be testing, it's an opportunity to actually bring you closer together and stronger.
And that's exactly what I noted with Christie and Perry. They have been through a lot, and I can see them getting closer together with the more and more challenges they had to face. And in fact, this couple had to go through IVF, and not just one round, and more than one. And I think they felt like after the first round of IVF, even another door is slamming shut on their face. So you see how the couples navigate these things, and the relationship could end up being stronger than where they started.
When it comes to unexplained infertility, and even as fertility as a whole, as a field, I think we're still a young field compared to other fields in medicine. There's a lot of exciting research happening. We're looking into other aspects of fertility, including unexplained. And over time, we are going to find some more explanations. They could be minor immune problems, they could be minor genetic problems. So I would say, watch this space. There's a lot of developments happening in the background, but what is also important is you have a good chance of success. Once you have that diagnosis, I would have a minor celebration that there is no big problem, no big fertility problem that I have. And I will actually feel confident that I have a good chance of success.
Absolutely.
Have that faith with your fertility specialist, and they will guide you to what should your next step be, whether that's another investigation, or sometimes we just go ahead and start treatment because we know you have high chance of success.
The field is evolving. We are learning and understanding more and more. And if you're diagnosed with unexplained infertility, you have a good chance of having a baby and completing your family.
Excellent. I think it's I feel a lot of the time when I have a couple in my room for their first appointment, my job is to empower them with information so they can make an informed decision in terms of their next step. That could be that we're happy that the investigations are normal. We'll continue to try for a bit longer, especially if they're young. Or it could be that we want to have 8 children, so we better get going and better start doing IVF, for example. We can free some embryos for the future. So we always try to individualize our treatment to the couple in front of us, while at the same time, we need to empower them with knowledge and hope.
Let's debunk some common myths around the topic, Yousif. I feel there is overall common misunderstanding: unexplained means no hope. And that is quite the opposite, as we have been talking for the last 20 minutes. Unexplained means there is all the hope in the world. When there is nothing wrong from all the structural tests we can do, there is a good chance we can help you. So it will come down to mainly the female age, how long they have been trying. So the sooner you can get help and see a fertility specialist and get help, better your chances are. Another myth I commonly see is if there is nothing wrong, it is all because of the stress. Go on a holiday, just relax, you'll be fine. How do you feel about those things, and how do you answer those things, Yousif?
I completely agree with you. When it comes to unexplained infertility, is what we, in a medical term, we call good prognosis. That means you have a really good chance of success. So when you get when you get diagnosed with unexplained, I would actually be happier. I would say there is no big blocks towards your fertility journey. You have what we call maybe subfertility, so maybe slightly lower chance of success. There might be a minor fertility issue, but we have a lot of treatment options to overcome it. Stress, yes, most of us are stressed day to day. Major stress events, major life stressful events can sometimes affect your hormones, might affect you in the short term, but it's unlikely to be the reason that's stopping you from getting pregnant over the last couple of years, kind of thing. I completely agree. It's a myth. If you have unexplained infertility, means you have lower chance of success. And I think it's unlikely stress is the only explanation.
At the end of the day, it will come down to all the factors we already has mentioned. So it is a good idea if you are over 35 to come and see a specialist if you've been trying for 6 months. And if you are under 35, you can afford to try a bit longer, especially if you have done the test and if they are normal. But let someone guide you and help you with decision making so we can individualize your care.
Absolutely. When you come to see a fertility specialist, our aim is not to start you on IVF the next day. Our aim is to arm you with the right test, with the right information, and then we individualize your treatment depending on your goals, the results of your investigations, and your preference as well, because that comes into play. And the other myth sometimes we hear is if you're diagnosed with unexplained infertility, that means you can't get pregnant naturally. So when you lower your guard and you go, or you stop your contraception, for example, if you're on contraception, or you don't go on contraception after having your first child, you might be surprised with the second child very quickly.
Absolutely. So I think that is a very good point to highlight. And when these patients come, they are successful, and when they are saying their goodbyes with happy smiles everywhere. That's one of the things I always tell them. Congratulations, I'm very happy for you. But please remember, there wasn't majorly much wrong with you. If you are not ready for your second baby, you have to be careful with contraception because you could be in a surprise when you're least expecting.
Couldn't agree more. I think I would leave the listeners with one last message. Unexplained infertility is actually a diagnosis of hope. That means you have a really good chance of success. So when your fertility specialist says you have unexplained infertility, don't be alarmed. That means there's nothing majorly wrong, and that means your chance of success is quite high. Remember to tune in to Big Miracles on Channel 9 on Wednesdays at 9 p.m. And if you want to catch up on previous episodes, the link will be in the show notes for Channel 9.
Thank you for joining us on Fertile Minds. We hope today's discussion has been both informative and supportive as you're navigating through your fertility journey.
You can find me on Instagram at dryousif.alyousif, or you can visit my webpage www.dralyousif.com.au.
And you can follow me at Dr. Kokum or visit my website www.drkokum.com.au. For more information about us, please visit Melbourne IVF website www.mivf.com.au.
For all things fertility, subscribe on Apple Podcasts, Spotify, or YouTube. Connect with us on Instagram at MelbourneIVF_official to join the conversation. Do you have any fertility questions? Send us a message on Instagram, and one of our fertility experts will answer your question in the next episode.
Thank you for listening. And remember, you are not alone in this journey. Stay hopeful and empowered. Until next time.